This is the first time we've been able to get together at a spring conference, face to face, in 3 years. And it's because of the choices that we've made and the extraordinary efforts of the British people that we are able to meet with no rules and no restrictions, having resolved together as a nation to rely on common sense and personal responsibility. And as we learn to live with COVID and plan a future beyond the pandemic, we do so as the most open country in Europe. But of course, the choices that we made were rarely easy. We decided to open up last summer in the face of some bitter opposition, including, of course, from Keir Starmer and the Labour Party, who wanted to keep us in lockdown. And don't forget, just this winter, we rejected Labour's demands for even more restrictions, instead choosing to bolster our defences with a record-breaking booster programme. And as we lead the world in learning to live with COVID, we of course have a great deal that we can all be proud of and a strong track record to defend. That doesn't mean, of course, that we can afford to be complacent. The pandemic has already consumed 2 years of government. So this year's slogan, it couldn't be more appropriate. We've got to get on with the job. And Blackpool, for me, is a very suitable place for that message. Because one of my first speeches as Health Secretary was delivered at a community centre not 10 minutes from this hall. I spoke about my determination to end the disease of disparity and ensure that everyone, no matter who they are, where they come from, everyone has the opportunity to live a healthy life. COVID brought these disparities into sharp focus, and in many cases, it made them worse. We promised real change in 2019. And if we want to win again, it's critical that the scale of our ambition matches the size of this challenge and that the radicalism of our solutions measure up to the urgency of the moment. Because we know that healthier communities get richer, and richer communities get healthier. We cannot level up our economy without leveling up on health. And in this country, we're all so fortunate to enjoy freedom from catastrophic medical bills and the certainty of knowing that the NHS is there, along with the exceptional people that work in it, and it is always there for us in a crisis. Yet even before the pandemic, our healthcare system faced many long-term challenges. Changing demographics and disease, the injustice of health disparities, and unsustainable finances. Do you know that the annual budget of the NHS is greater than the GDP of Greece? Yet this decade is likely to see the fastest pace of aging of any from the 1960s to the 2060s, with many more people living with long-term health conditions. You know, I remember a 16-year-old William Hague telling Party Conference. Now, do you want me to try the accent? Do you want me to give it a go? Yes. Right. I'm smiling because my wife is in the audience and she told me not to do it. But anyway, it's all right for you. Half of you won't be here in 30 or 40 years. Sorry to William. Well, I don't know if any of you remember that, but a young 16-year-old William Hague said that to a party conference. Well, conference, I'm afraid to say that it isn't all right for you, because with any luck, most of you will be here in 30 to 40 years' time. Because the truth is that we've come to a crossroads. We must choose between endlessly putting in more and more money or reforming how we do healthcare, between increasing waiting lists and raising taxes or a healthcare revolution. Now, I'm sometimes asked if Conservatives have given up given up on public sector reform, whether we've become some kind of soggy-bottomed social democratic party. Well, I'm here to tell you that that is nonsense. Last week, I set out a vision for comprehensive healthcare reform, building on the Adult Social Care White Paper and on our plans to tackle the COVID backlog. And the principles that underlie that agenda, they're actually quite simple. I want to prioritize prevention and redesign services around patients. I want better performance standards and freedom for frontline innovators. And I want to put power where it belongs, back in the hands of patients. Prevention, personalization, performance, and people. That is how we will reform the NHS and bring about the biggest transfer of power and funding in decades, from an ever-expanding state to individuals, families, and communities. That starts with a new emphasis on prevention. Do you know that if you take the total NHS budget, around 40% of it goes on preventable diseases? We spend too much time on the symptoms of ill health and too little time addressing the causes. There is no small state that isn't a preemptive state. I want to shift our healthcare system to a new way of operating, one that's about helping the whole population to stay healthy, not just treating those people that turn up and ask for help. We need to put power back in the hands of patients. And that is why I will be significantly expanding the number of people with personal healthcare budgets, and I will drive a radical acceleration of personalized care. And I will introduce a new right to choose for long waiters, because I'm interested in choice for all, not just the privileged few. And finally, any reform agenda requires a relentless focus on performance. When it comes to delivering affordable drugs or accessible care, we all know that the NHS ranks amongst the very best in the world. But in areas like cancer survival rates, cardiovascular disease, we also all know that the NHS must do better. And that is why I'm committed to improving leadership in the NHS and social care, starting with the review that I've asked Sir General Gordon Messenger to do. And that is why later this year, we will launch a new mental health plan, a new digital plan, and a new 10-year cancer plan. So let's remember, first, we've come so far as a country. We are now the freest country in Europe, and we will always be the party of opening things up and not closing things down. But we have so much more to do. It's our mission to deliver on recovery and reform with determination and purpose. So let's go forward together. Let's deliver for the British people together, and let's get on with the job. Thank you all very much. Thank you. Thank you very much.